Every year, more than 2 million of us get a visit from a district nurse.
We keep a lot of people safe and in their own homes.
Hello! We become really close to our patients. We're in their lives for years.
10,000 of them travel all over the country to wherever they are needed.
You really never know what you're going into.
It can be life and death for some people.
From our birth
Hello!
to old age.
Happy birthday!
They work day
Just put the light on.
and night
Oh, she's looking gorgeous, isn't she?
to help us through the toughest times.
Oh, don't cry.
Oh my goodness.
You've done absolutely amazing. I can't believe I'm home.
I'm lucky. I am so lucky.
East Riding in Yorkshire. It's sparsely populated, mostly farmland, and it's been District Nurse Gillian's patch for over 20 years.
It's lovely. I know you just slot into the community. Morning. Afternoon. She's doing well at the minute, isn't she?
Yeah, really.
Yeah, she's so good.
Morning. You all right?
She works in a team of 12, looking after more than 500 patients.
We go and visit people at home. Anyone who can't make it down to the surgery for whatever reason, we'll go and carry out the care. And it's nice to see people, because you go and see them when they're at home and they're poorly, and it's nice to see them when they've got better. That's looking a lot better though, isn't it? I'll see you later. I'll see you later. We'll see you next week.
Yeah, okay.
When you're at the top of the hill and you're dropping down, you can see it all. Think, wow, this is my office.
This morning, Gillian's been called out to a brand new patient, Christopher.
So I always find it a bit unnerving when I'm going to see somebody for the first time, because it's just the fear of the unknown. You don't know where you're going, you don't know what they're going to be like. That's not the drive, is it? Oh yes, it is. Oops.
Now then, come on in.
Hello.
Hello.
Christopher, I presume.
Yeah, it is indeed, yes.
Is it all right?
Yeah, come on in. Come on in.
I'm Gillian.
Yeah,
I didn't,
sorry, I know
I didn't
Linda,
say
yeah.
that bit. Linda
Yeah,
did tell you I was
thank
coming up.
Say hello.
I bet they're not normally this quiet, are they?
Well, he's not bad actually. He's pretty good, isn't he? He only cries when he's hungry, nappy changing, or tired, or he wants his mum. But he's marvellous. He's just,
Is he your first one?
Yeah, he's my first, yeah.
5 months ago, Chris was rushed to hospital with severe stomach pains. The surgeon discovered a large cancerous tumour.
And I opened my eyes from that operation. He was stood there above me and he got his hat on and he got his mask pulled down. And he told me what he'd done. And as he's telling me this, I feel like my whole world's collapsing and I'm sinking into this stretcher. And he said, but don't worry. He said, I'm confident I've got it. And them words, you have faith. Because this man you've never met in your life has just had his hands inside your stomach, cutting bits away, and he said, but I'm confident I've got it.
The operation saved Chris's life. But now home, he has to have a 4-month course of chemotherapy.
They've got the tumour out, so this is more of a belt and braces treatment now, hopefully. There's always a chance it'll come back even if you treat it and you get the all clear. But you just focus on the positive. Can't sit there brewing about it, because otherwise you'd never get anything done, would you? And there's lots of things to do.
Chris will receive the drugs through a tube in his chest.
Just put that on there. Put it on the right way around, it might help, mightn't it?
The thing with it all is, you feel well, and if you feel well...
You look well.
I feel marvellous. And
You might find this chemotherapy might start make you feel tired.
having Oliver as this is nothing. This is just a little bit of a blip. This is something
Well, that's
that...
what life's all about, though, isn't it?
Of course it is. All the money in the world can't buy you time with your family. All the money in the world don't put a smile on your face, does it? It's just... It puts things in perspective. That's what I think it does.
It's going to be a very tough few months. You always put yourself in that situation. You think, well, how would I cope with it? And I don't know whether I cope with it very well at all. He seems to be doing really, really well.
200 miles away in the city of Bath,
Who have we got next?
Jackie is a physiotherapist.
Is his balance all right? As far
His balance
how
is
did
quite
he injure
good.
his shoulder?
He fell over. He was out in town and he fell
tripped
over.
over something.
Anterior dislocation.
I see.
She's part of a team who look after around 160 different patients at any one time.
Being a physio is very, very varied. I don't know what to expect from morning till the afternoon. I thought I'd come around and see you today sometime or tomorrow. What would suit you? I do enjoy getting up in the morning and going to work. It's a sort of unknown day ahead and I'm fairly confident about being able to cope with it, whatever situation comes my way.
This afternoon, she's going to see a retired couple. Dennis is a former engineer. He and his wife Mary are keen cyclists who ride a tandem. But 1 month ago, Mary fell in the street and broke her ankle.
This is such a blow for me, really, because I like to be mobile. I like to go out on the tandem, and I can't get on the bike. It's just driving me mad.
The tandem was originally Dennis's idea.
We got the tandem so I could ride it, and so we used to go off on holiday. We had a little trailer for the back, didn't we?
Yeah.
Go camping. I first hated it because you felt as if when you were going along the road you were going to fall off any time. But after that I loved it, didn't I?
They met 39 years ago and married after just 4 months.
He was quiet. He was really so shy. He didn't say anything.
I don't talk enough. I am quite quiet, an introvert, as they would say. I'd not had a lot of girlfriends, and I think Mary sort of brought me out more than I normally did.
We've had our ups and downs.
Like all couples?
Yes. Yeah. But I've never stopped loving him.
I never stopped loving you.
Jackie's been working with Mary on her ankle for a month, but there's a small bone of contention between them.
I do forget the stick. And I think, no, I should be all right. Old people use sticks.
When I first saw her, I thought, oh dear, she's limping along. And I bought sticks for her to use. And she's now using them and should be using them when she comes to open the door to me today.
Hello, Mary. Hi, morning.
Hello,
Morning.
nice to see you again.
Thank you.
Doing all right?
Yes, not too bad, thank you.
Good. You're not using your stick?
I try not to in home.
Is your ankle hurting at all?
Yes, it does. But if I know I've got to use my stick.
You need to use the stick. Do you take the sticks upstairs then? You don't use anything?
No.
And seeing the way you're walking, I'm really not happy. No. I'm working along with you on this.
I know.
And
yes.
I can see what makes you tired.
Yes.
And puffed.
Yes.
And when pain creeps in, I know it's hard work for you.
Yeah.
I can see through
yes.
this.
Yes,
and
I know.
that's why I'm guiding you to use the stick.
I can understand you saying it.
Yes.
But when Jackie comes to begin with, she gave a strict headmistress sort of feeling. I thought she was going to be like headmistressy. I felt, oh dear, yes, okay. But in fact, she's really, really nice.
Mary, you've forgotten your stick. Mary's quite ambitious and very positive, which is nice for me, but at the same time I have to hold her back a little bit. Use your stick, please, to come round. I'm trying to train you. It's like a little dog to carry a bone, carry your stick.
Thank you, Jackie.
All right,
Thanks
bye.
ever so much. Bye. I'll see you again.
Bye.
Cheers. Bye. See you next time.
She's in a bit of a hurry to progress quicker because she wants to get on that tandem, but as long as she uses the aids that I'm advising her to at the moment, she should do all right, and I think she's understood that now.
Remember to bring the stick.
Oh,
Jackie will go mad if I forget, won't she?
you will.
Okay. When I broke my ankle, I've had to rely on Dennis. He's been really, really lovely. I think sometimes you need some problems to...
Bring close together.
Yeah, but not only that, to make you appreciate what you've got.
Now then, Freddie, how are you? Marvellous.
Chris is trying to get back to normal life running his haulage business.
You'll have to come up and pick it up though, then that'll be an excuse to have a cup of tea and a natter for an hour.
Between Nurse Gillian's visits, he's able to take his chemotherapy on his own.
Here's a little pumpy, which it looks pretty, maybe gruesome, but it's not. And it doesn't hurt, and it is not uncomfortable. And it actually goes into a vein in my neck. And that's the chemotherapy treatment for the next 2 days.
It is weird. You find yourself saying, are you all right? Are you all right? Are you all right? Because you expect, having sat there, having drugs put into your system for 6 hours, for somebody to not feel very well. But he's fine. He was fine. He had a bit of tingly fingers and things, but he was fine.
Yeah. It's spooky, isn't it? You know, you go to bed and you lay in your bed at night when everything's still and quiet, and you think about what's happened in the last few months, and you think, God heavens, you know, crikey, this is just, you know, you get catapulted into another sphere that you didn't know existed, and it just changes your routine, it changes your life.
I've come to give you insulin, that's right, isn't it?
In Yorkshire, Gillian's doing her rounds.
And I haven't seen you for a while. I tend to come and see you on a weekend, don't I? How are you diddling? You look a bit better than the last time I saw you. I can't imagine ever doing anything else. I'd miss everybody. Good morning. Come on, let's go ahead and do your blood.
Now she's going back to see Chris, who's been having chemotherapy for a month.
Because you've been diagnosed with cancer, and then you've got to have all this horrible treatment, it must be a lot to cope with. Chemo's like having pure domestos put through your system, it just kills off everything. Hello? Are you in? I saw you yesterday in Pocklington.
I thought it was you as you drove past, yeah.
Hello.
Hello everybody, hi darling.
And how are you?
I'm alright, I'm in a muddle this morning because I've had a breakdown this morning. Blooming lorry broken down.
Are you alright? Are you with us now?
Yeah, I'm with you now, I'm all yours now.
Today, Gillian needs to take some blood.
Do you know why we're taking the bloods today?
We make sure that I'm fit to take the chemo ready, isn't it?
That's right, yeah. Because if your blood levels are a bit low, if you're a bit too anemic, if the chemo's worked too well really, they'll not want to put any more in. They'll want your blood levels to get up a little bit first.
Freaky, isn't it?
Is it?
It's a bit, yeah. When you see a pipe hanging out your chest, it's like a nose pipe, isn't it? It's like, Want to give it a pull?
Your blood... No! Don't you go pulling it. bit more.
Oh, look at that. It's oozing out now.
That's better. He's going to feel tired and he's going to feel a bit rough. But then I think feeling like that, you know the treatment's working. And I think that's what keeps you going. Is your hair and everything going to fall out after the
I haven't got much left anyway, have I, really? No, it hasn't, no.
Have they told you whether it's going to or not? I mean, sometimes it does, sometimes it doesn't.
Well, if it goes, if it starts to drop out, it starts to drop out, but I mean, it's not...
Shave it all off and wear a woolly hair?
Well, yeah. Then it'll come back, you know.
Anyway, I need to get your blood sent off.
Right.
At the minute he's doing well. Hopefully he can keep it up. And he's got a very supporting family that'll help him.
Is it bop time? What's this? End of the day. You make it all worthwhile, don't you? It don't matter, does it? Oh, don't cry. Don't cry. Yeah.
In Bath,
Right, so
Mary's been using her sticks, and her ankle's nearly healed.
yes, she's brought it round for
Oh my
us.
goodness me, look at that.
Yes.
Now she wants Jackie's advice on how soon she and Dennis can get back on the tandem.
That's amazing, isn't it?
Well, it's the only bicycle I can ride.
Wow. And how far would you intend to go on it?
Well, we do about 15, 18 miles.
Do you really?
Yes.
Oh,
Oh,
fun.
yes. And it's lovely and comfortable. I've got a seat to sit on, not a saddle.
Oh, you have.
So
I can
yes,
see that.
so it's really, really, really
Well,
comfy.
this is obviously a good thing to aim for.
Yes.
But
And
we'd
it
have
will
to
be no-
practice getting down and up off
Yeah.
something else first inside, I think, wouldn't we?
Oh, I can manage to do it. I just, when I go to get there, I'm used to it now.
On it then.
I just pick my leg up and then I sit down.
I do most of the work.
But he doesn't. I do as well.
Well, it's good teamwork
Yeah.
then.
It is.
Yes, it is. He's got a good boss. Okay, you can take it back now.
Thank you.
Thank you, dear.
I think it'll work quite well.
Oh, bless
Maybe in the next couple of weeks, perhaps.
Oh,
we'll look
brilliant.
at that.
Yes, can't wait. Maybe quicker than that.
Gillian's returning to Chris. This will be her final visit. His treatment isn't over, but he's leaving the area.
As he's moving, we're not going to be able to find out what happens to him. But Suzanne, who works at the health centre, is friends with Chris's wife, Lisa. So she's going to keep us informed, see how he's doing.
Now then, you know next week?
I know, I've just been talking to Suzanne.
Oh, have you?
Have you registered with anybody yet? Oh.
There's an envelope here I've got to give you.
I was going to say, I've just seen one somewhere. It says district nurse. It did.
Right.
It was with all your papers.
Yeah.
What does it say?
Chris has coped well with his chemotherapy so far,
You're due to come next Thursday, aren't you?
but he still has 2 more months of it to go.
So when you're actually moving? Tomorrow?
Tomorrow.
Well, you've always got our telephone number,
Mm-hmm.
haven't you? Because I know you're moving out of area, but you can still ring us up.
Good, thank you.
His care will now be taken over by a new team of district nurses.
Right.
Is that us, isn't it?
It is.
Well, thanks, Jill. And thank Linda for me.
I will.
And Karen.
I will.
Yeah, so I'll see you. Well, I'll see you, won't I? But I'll see you and pass it
Tell
along.
Suzanne just to keep us informed of what's happening. Oh, well, I hope it all goes all right.
It will, though, thank you.
You'll be fine.
No, I'm sure it
Won't
will.
you?
Gotta be fine.
You have?
Can't be anything else. Take care.
Any problems?
Mwah.
Give us a ring.
I will indeed. Thanks ever so much. Thank girls for me, won't you?
I will. I'll tell everybody thank you.
Drive safely.
I will. I always do. I get lost, but...
What's them pheasants?
See you later. I do admire him, yeah. I admire him because it's just the way he's coping with it all. And he's still got a smile on his face. He's coping at the minute. And I think he will. I think he's that kind of a character.
Everybody knows about cancer. Everybody knows that that people get these problems, but you never in a million years anticipate that it's going to be you. Scratch your leg. I'm scratching your leg. But I'm lucky. I am so lucky, because A, it was caught in time, and B, the treatment that I've had has worked, and everything that has gone perfect. There's been no complications apart from this little bit of chemotherapy, which is neither here nor there, you know. So I count my lucky stars, I really, really do. I'm a lucky man, aren't I? Look at this. How lucky am I? It's nothing.
Okay?
Yeah.
Okay?
Yeah. Oh, that's lovely. That is really great.
We're going uphill now.
This is where I stopped pedalling, is it?
I thought you had stopped pedaling.
No, I haven't stopped pedalling.
Oh.
Oh, look.
What?
Swans.